So good morning and or good afternoon, depending on where you're calling from. I know we have some joining from London today. So my name is Samantha Flores, and I'm the director of Hugo, which is Corgan's research and innovation team. And today we're welcoming you to the first part of our four-part series, where we're going to dive into design research within our newest publication, which is called Design Informed by the Pandemic. And it's really just a guideline for the COVID-19 best practices in human-centered design. It's really Corgan's guideline that we have been researching for the past few months. And this publication focuses really on two things: how human behaviors are changing through emerging technologies, and how these emerging technologies can support the changes to create long-term value in our built environment. So this book really covers an extensive amount of content. There's a lot of different articles, a lot of different subjects and topics that we cover and explore and kind of experiment with. And all of it has been a collaboration between Hugo as well as the architects and interior designers at Corgan. I mean, hundreds of them participated in this throughout all of our offices, all industries and market sectors, as well as outside contributors. We had a certified industrial hygienist join us in our studies. We had PhD students from various medical fields, indoor environmental quality experts help us with understanding, aerosol passage and things like that, mechanical engineers, structural engineers, behaviorists, cost management specialists to help us make sure that what we're putting forward is good for the budget. So it's really important, at this time that all of these great minds kind of come together in these conversations so that we can kind of holistically understand the value that the new behaviors that we're building are creating, and also the value that the technologies we're adopting in this time can see moving forward. So we're looking at, how we design, how we communicate, how we build, develop spaces, and ultimately make people feel confident coming back into the spaces that we're creating. So that's just an overview of the publication. It's launching today. We're really excited. It's already launched. You can find it on our blog. And each webinar in this four-part series will cover a unique topic centered around different sections within this publication. And we'll have different industry experts as panelists each time. So this first webinar will focus on the current pandemic and introduce new opportunities for us as architects, as builders, as owners, as operators, and even as end users to rethink the value that we put on place. And looking at the past and the current pandemic, we're looking for innovative long-term solutions, not just knee-jerk reactions that will drive healthier buildings and happier occupants far beyond what we're considering the new normal. So just so you know, these webinars will be recorded and distributed to everyone after the meeting as well. So if you want to take a look back at some of the conversation that's had today, you'll be well equipped to do so. So with all of that being said, I would love to introduce some of our visionary panelists who are joining us today, experts in their own field. And Chris, why don't you go ahead and start and introduce yourself to everyone?
Yeah, thanks, Sam. Good morning. Good introduction. My name is Chris Nicholas. I'm on the healthcare team here at Corgan. And we are dedicated to helping our clients find new ways and better ways to care for their patients, especially the last couple of months.
Perfect. That's really great to hear. We have Emily Strain joining us as well. Emily, why don't you go ahead and introduce yourself?
Hi, Emily Strain, Director of Workplace Strategy, focusing on people and culture in the workplace.
Awesome. Next, we have Robert. Why don't you go ahead?
Yeah, hi, I'm Robert Bilomovitz. I'm the commercial lead for Corgan's Atlanta office. I joined Corgan in 2018. One big reason I did so was because I think designers should be idea people first, and that's what we are here. So actions should follow on ideas based on forethought. I joined a group that walks the talk, and that's part of how we're able to conduct what we're doing today. So I hope today's helpful for everybody, and I hope everyone can come away from it understanding that we see a lot to look forward to.
Well, that's really great, Robert. Thank you for that. Carolyn, Carolyn Mulligan is also joining us.
Hi, yeah, my name is Carolyn Mulligan. I'm an architect and project designer on our commercial studio. One of our passions is trying to find ways to basically replicate the company's brand and passion in built form. And that's something that we're really excited about. Every company has, and every work is different, right, for different companies. So we've had a really fun time working with Emily and her team, trying to make sure that our design exemplifies your brand.
Awesome. And last but not least, we have Jason.
My name is Jason Mallard, and I've had the opportunity to work with education clients over the last 15 years and to lead creative teams within our office to develop really creative solutions for districts to provide the best solutions for each individual student.
Perfect. So like I mentioned before, we're really bringing together experts in a lot of different fields to have this discussion today. One thing that we've been seeing over this, time period is that we really can't have siloed discussions anymore because everything is influencing one another. And I think that one of the topics that is pretty much, on everybody's mind right now is, what's the return to work look like? What does that mean? How are we going to make that happen? And, Corgan has covered this topic extensively in both the publication that we launched today, in Square podcast episodes, as well as previous webinars that we've hosted. And so we've talked a lot about the how, and the how is really important. But today, I think it's really necessary to focus on the why we want to return back to work or learning environments, etc. And so, Emily, I'd love for you to start off that conversation.
Yeah, absolutely. I think the simplest answer here is just community. I mean, I love talking to all of you guys in this Brady Bunch format, but I really do miss seeing you in the workspace. I think in a work environment, there's kind of this spontaneous interaction that happens that doesn't really happen digitally. And so I think that's a huge plus, and something I'm personally really looking forward to. And, workplaces, physical environments, they're really kind of incubators for culture. There's a lot of design features within a workspace that point to a company's values and what they, believe in. So things like hierarchy, collaboration, do we value wellness? Do we value our employees? The design choices that companies make and that we work with them on, those really kind of point users to what they value. And then, the other thing that's a big part of culture is behavior. And so how companies engage with each other and how people within a company engage with each other through their body language, and those kinds of things that don't always come across digitally are big sort of culture informers. So during this time, I know companies that have really strong cultures have been able to kind of take those into digital, and we try to do things that we can to kind of patch it. But I think a lot of the great culture that is formed within space. So personally, that's what I'm looking forward to getting back to, is the people that I work with.
I think that's really interesting because you said something about how we are understanding the value that people are putting on work at this time. And I'm wondering, Carolyn, are there different things that we're seeing emerge from this work from home situation that maybe we would bring back to our work environments, or vice versa, maybe?
Yeah, there has been so much to learn from this giant unplanned experiment we've all been living in for the last 3 or plus months, right? And, we've done our own internal work from home survey here at Corgan, just to kind of gauge how our own employees are doing during this. And one of the biggest positives we've learned from the work from home is that people have really valued their freedom of choice. That's huge. There's a lot of little things here and there that they've all been saying, but the underlying theme is freedom of choice. So how can we replicate that freedom of choice when we go back to the office, right? If you think about it, everyone at home has equal opportunity to sit by a window while they're working, or to get sun, to have access to daylight, or to step outside when they need a break. They can move around their space as they need or want. So, when we think about how we can help encourage people to come back to the office, the last thing they're going to want to do is sit in these very, very rigid rows of really space where they don't have those freedoms anymore. So, luckily over the last couple of years before even COVID, we've transitioned our office design mentality from a factory production or human as machine thought to a human as collaborator, or how can we design buildings and spaces that are task oriented. So we've already been moving into this trend, and I think this has even accelerated it even more. So we're using the phrase democratization of space, and really starting to look at how can architecture actually inform that and help that. And there's so many ways we can do that. Just for example, is just rather than looking at a four-walled building, how can we push and pull parts of that facade to create more corners, more areas for perimeter, so people can sit near the perimeter, not just for their bosses, right? How can you look at your buildings and plan and in section to bring daylight all the way through your spaces, whether that's through courtyards or terraces or whatnot, but just basically trying to replicate these positive benefits from being at home in an office. And then conversely, the other end of that, and we know that there are companies that are going to allow their employees to choose to work remotely full-time if they want to. And so one of our research initiatives that we've been doing with Hugo is looking at a remote work branded environment. And just like Emily's saying, like culture is such a huge part of our work life, right? So if you're working from home, how can you bring your company's culture branded, whether with products or sit-stand stations or coffee gift cards or whatever it is, how can you bring the culture of your company to someone's work environment? So more to come on that, but we're really excited about that research study as well.
Carolyn, it's so huge, the shift that we've all made to working from home. As we look at students, and teachers in schools and how they had to adapt all of a sudden to providing the remote learning from home model, there's been a lot of challenges with it, but a lot of opportunities as well. Just a chance for students to be able to learn in all different places in their home, whether they want to relax on their couch and read a book. Some students, they want to be at the island in the kitchen where there's a lot of activity and they have their headphones on, or they can, ask their parents for help whenever they need to. I know my daughter, she likes a very structured environment. So we put her desk kind of in the corner of her room with next to the window with the natural light, and where everything that she needed was within reach. We've, before this, really sought to design schools in a flexible way, collaborative way, and to bring the idea of home into a school to allow students to be more comfortable and flexible in their schools. So I think as students begin to understand a little bit more how they work best and where they work best, teachers and designers can leverage that information to make the school environment when we come back post-COVID even more engaging for students. I'm really excited about that opportunity.
I love that, how you were talking about, the working from home environment translates back to a learning from home environment. And I'm also curious, while we think about these working situations from home, there are some service industries that just can't follow that model. And healthcare is actually one of them, Chris. And I wonder, what are we learning during this time that might impact how healthcare delivery evolves moving forward?
Yeah, Sam, that's a great point. Care delivery, if you're getting a procedure done or you need to have that FaceTime with your doctor, you still need to be in person with them to some extent. But I think as Carolyn mentioned earlier, some of our research that we've done with Hugo and your team, Sam, is there some of those things that you do treatment-wise and plan-wise that can be done virtually. We've all had to learn how to, like this meeting, we've all had to learn how to adapt and do things more virtually, more in an off-site setting. So I think what we've seen, telehealth is one of those examples of it's been used, but it hasn't been adopted widely until now. I think this has been an impetus for people to really start using that more and be more comfortable doing that. So telehealth we've seen it's taken off exponentially, and we've heard anecdotally from systems that we work with that it's put a big strain on them. It's changed their model. Luckily, we were working with a large independent physician practice here during the month of March, and we were able to incorporate some of what we learned from our team, and they were studying on their side to incorporate more telehealth spaces. So when doctors can go in and they can plug in and have a nice background, have a good audio, great lighting, so they can see their patients can see them. So we've seen that, and I think that's what's going to lead to is a really integrated model of care that we'll take advantage of in the future, where those times that we don't need to go to our doctor, it gives us flexibility, like Carolyn mentioned, to take care into our own hands and decide when and where it fits into our lives. Because making just a routine clinic appointment takes up half a day, or if you're taking kids, you got to go grab them from school. I mean, it's a long round trip. So if we ever do that virtually much quicker, I think we'll see that change in the future.
Yeah, and I remember when we were talking to some users for a healthcare project, they were mentioning that they had just started using telehealth, and that while they enjoyed the ability to do that, they still also preferred to go into the healthcare space to visit with their doctors. Some people really build those good relationships with their practitioners, and that observation that we did, understanding users and surveying them, was really to help move forward some of the healthcare design work that you guys are doing. And I'm wondering, since we did have to move all of that virtual, just asking quickly, was that helpful for you guys? Did you see any discrepancies in the process moving things virtual?
Yeah, we've had to learn and adapt. I think everybody on this call has to some extent in how we present our ideas and our concepts. So we put a lot of thought in how do we communicate, design change during DD or CDs and getting approvals virtually. I think it's been an important thing because it's strengthened how we communicate with our clients. But more importantly, it's given us the ability to keep, that continuity and show that we're still a group that is we love working with you. We love, doing the design work we've been doing, and we can do it in a different way if needed. And I think also, Sam, your team did a really good user study, focus study for a client of ours and that's looking to do some development in Austin. And, being able to pivot and do that virtually too, and come out with a great product was pretty exciting as well.
It was really a lot of fun to talk to users across the US and then in the Austin area for sure. And, doing it virtually didn't feel as different. There wasn't that technology barrier, I guess, because we're all virtual right now. But Emily, I know you had to move a lot of your workflows virtually, and the way that you interact with clients is inherently, person to person, face to face. So, what do we see in your experience that may be here to stay?
Yeah, so what was really kind of interesting for us is, just like you said, we did a lot of in-person work. So I previously used to fly all over the country doing visioning sessions, design thinking workshops, observation, those types of things. And so when this happened, we were sort of forced to very quickly reimagine our process. And I think there was some really good innovation that came out of that. Things that I think we will continue to add to our toolkit in our practice. So we developed an online collaboration platform that we engage with at the beginning of the design process to help people build consensus and to understand different perspectives. And what I found to be very interesting and a little bit surprising is kind of the rawness of the data that we've been given. I think sometimes it can be negative that you can sort of hide behind technology. And I wouldn't say people are hiding, but I would say that there is a level of honesty that maybe comes out a little bit more when you do gather information that way. So I don't think it's a substitute, but I do think that it's a good kind of new, rich way to get more information about our clients. So it's been fun to innovate and think differently.
Yeah, it's definitely a great way to augment the process that has already been working for us for years. And education models are changing too. They're allowing, different virtual settings to augment the classroom environment, mainly out of necessity. But, I'm wondering, I know there's much discussion around whether students will start the school year fully online or in some type of blended learning model. And I'm curious, Jason, what opportunities or challenges do you see associated with any of those hybrid models or fully online models?
Yeah, absolutely. I mean, that's front of mind for all educators as they're going through the summer, and a lot of the school years are planned to start earlier, so they're kind of up against the time crunch on that. But there's studies that's been done that 25% to 60% of information is retained more when students are learning online because they're able to focus better, they're able to go back and retrace information. But what they're missing out on is that interpersonal connection that's so important for young people in their development, especially for elementary age students. If they are going to be online, having more than just a live video feed is critical to be able to have interactive virtual whiteboards or blogging, polling to take place would be really important. And then there is an opportunity, a lot of the education administrations are requiring separation of students in classrooms that could limit some classrooms to be between 12 to 16 students. And there's an opportunity there in that small class size, to adapt learning a little bit differently. Would there be more participation, more discussion that's able to take place? Less students hiding in the back of the room because they don't want to speak up, maybe less disruptions there. So I think that could be a good kind of experiment to see how things could be evolved there that would carry forward in other areas. And then, finally, reducing the walls of the classroom, basically through digital media, deconstructing those classroom walls. There's an opportunity too, if we want to get as many students in the school as we can, to utilize the gym or the cafeteria, the library, collaboration spaces for overflow, So you could have, a full 30 class student population there, but half in the classroom and half outside the classroom, still in the school building, still eating lunch with their classmates, still getting to socialize, but keeping that social distance. That's important.
Yeah, with the learning environments changing, the working environments changing, we're learning a lot about how parents and school children are working together, or even college level children or students are working together. And there's a lot of, new mental health concerns out there. I know that we have seen online platforms like virtual babysitting coming to fruition because there's a need for that on both the educator parent side and the student side. But I'm just curious, are there any concerns that are surfacing right now with the changes in the school environment and the education environment?
Oh, I mean, absolutely. It's stressful, and not just for the students, but for the teachers. I have some friends that are teachers, and, if they're going to be in school every day, but their kids are not, how do they take care of their kids when they're at home? And mental health has been a huge emotional health conversation in school design for years, with the rise of social media, bullying, test anxiety. It's hard enough what they're dealing with so far. Then when you overlay the layer of COVID, it's even more challenging. I was talking to a principal this week of an elementary school who had several students that just hadn't checked in last year. And, it's easy to think, okay, maybe they're just at home, goofing off or not interested. But she got calls from 2 parents that said, hey, I'm so sorry, my kids haven't been involved, but I've had to take them with me to clean houses or paint homes, 8 hours a day. So those students are bearing the burden, not just of their own learning, but of their household, in this difficult time. And a huge impact on students for their emotional health is the emotional health of parents and teachers. If, administration can really empower teachers to have the tools that they need, both physically and mentally, to come into a school this year, really engaged and excited for the students, that's going to transfer directly to them and set them up for success this year.
Now that sounds like something that would really, translate to the healthcare environment as well, Chris.
Yeah, exactly. I think, a lot of the ideas that Jason brought up and the concerns are what we see society-wise. I think we could have a whole webinar just on mental health and how it translates in all the work we're doing, because it's a big topic. And some of the big, findings we found out during this research process with Hugo is that, even during SARS-1, the first epidemic, there were some ripple effects of mental health problems and physical ailments coming out of that because of the anxiety, the isolation, even the physical problems of contracting the virus, and then what that does to your mental health afterwards. There's a bigger portion of that we could always address, and we'll see some outflow of that in the next 2 or 3 months. And how do we deal with that? I think there's some solutions out there, and that's something that we'll be working with our clients to figure out. But in the near term, what about people with underlying mental health issues who haven't been able to get to their doctor because, they quarantined patient care to just people who had the virus, and they're just, they're trying to gather supplies and keep everybody else out. So we'll see some issues with that. I think telemedicine has been a big issue in helping provide that interim care. There's still a stigma involved in mental health. So even telemedicine as just a way to not have to go to your clinic, but still get the help you need is a big issue. And then we also look at it from just a staff concern, just like we are in our own offices, coming back with, isolation. I think, was mentioned earlier is that interpersonal connection is something we've definitely lost in the last 2 or 3 months. So staff burnout is one of those things that it's part of that as well. Staff burnout's been an issue for our clients and for us for a while, because if you look at nurses providing care, it's one of the most stressful jobs there are, and nurses notoriously are awesome and great providers of care for other people, but for themselves, they don't do as well. They typically sacrifice their themselves physically and mentally over that 12-hour shift they're working. So we've been working with clients to really provide really effective ways for them to find a way to go and take a break. We've polled some nurses in the past, and we would say, where would you go if you had a difficult day, or you had a particular case and somebody passed away or somebody you cared about? Where would you go? And a lot of them would go into the bathroom. That was the only place where they could find solace and be able to cry, or jump on a phone call. So we've been providing, just at the minimum, respite rooms, a place where you can go and and take a break, place a call. And we have some research coming up in the future where we have some me moment pods is what we've called them, where you could go and you can go and take that respite and it'll track your vitals to see how effective it is. And I think, some of the things, this is not just a healthcare issue, but we'll see some of these. I know, Emily, you're going to talk about this in a second, but providing access to outdoors. We've long known that if patients are able to see the outdoors, they heal faster and their emotional, well-being is better. So I think we're seeing a lot of those things translate into the workplace.
Yeah. I mean, I really want a me moment pod. Can you send me one of those, please? I would love that. I mean, Chris, I totally resonate with what you're saying. I think mental health has been a topic of conversation in the workplace for a really long time now, and we've definitely seen it increase pre-COVID and expect that it will continue. At the outdoor space thing, I couldn't agree with you more on that. There's been some studies done that when you get out of your indoor space and you go outside and you can actually see the horizon line and you can see a perspective, that it reduces your stress level. And it also opens up your mind for creativity. So I have found myself during this work from home time, maybe before it got really hot here in Dallas where I'm at, taking conference calls outside, just trying to kind of put my mind in a little bit more perspective. And what's so interesting is that at our office in Dallas, we have an amazing outdoor roof space. And I'm like, when I go back to the office, that's where I'm going to be taking my conference calls from now, is that space. So I'm really thinking that in the future, we're going to start seeing a lot more outdoor space, probably across all market sectors, in education and workplace, and in healthcare, just because I think people have really kind of enjoyed that during this time.
Yeah, Emily, we just finished our phase 1 of our Schwab campus design, and that landscape design was such a huge part of how we designed the overall campus and how we wanted employees to experience their workday. You mentioned to me how you've been zoomed out. We've all zoomed out on calls. So even working from home can get you into this whole stuck in this digital world that you need to escape from. So digital wellness is something we've been talking about a lot. But on the Schwab landscape, there's streams of running water. You can hear the sound of water trickling down. And one thing I've been laughing about with some of our friends is like, how come all of a sudden we're all interested in gardening now? It's like there's something to it. Like people are caring about tomato plants and they never used to. So there's something to that. And what's interesting is like, we're on the end of this whole SMAC technology revolution, which is social, mobile, analytical, cloud, right? But simultaneously, we're learning more and more about the human brain and what actually makes us productive. So, for the Schwab design, we debated, we have an amenities building where there's a dining hall and cafeteria for all the employees. It's a separate building. And we spent time figuring out, should we connect the buildings underground to that? Should we connect them above ground? And then, finally, we all were like, no. We decided to keep it all surface level, right? Because we want people to force them to get outside, touch the grass, see the bugs in the nature, whatever. And despite the fact that Texas summers get to 100 degrees, that 2-minute walk is so important to your mental health, just getting out of the office. So humanity kind of does we kind of go back in these cycles of returning back to the basics, right? We try something and we countercorrect just to learn from our own mistakes. So just getting back to nature and whatever that looks like for your campus or urban office is super important, not only to retain employees, because people are now interviewing your building is the phrase you hear a lot, but also just for your own mental health.
Yeah, Carolyn, that just sparked something in my mind. What if we combine those two trends of like community and outdoor space, and we can do like outdoor gardens for people?
That'd be great.
At workplaces, that'd be so fun.
I love that. There's a lot of research that you mentioned, Carolyn and Emily, about how the outdoor environment kind of helps us with our mental stability. And there's one particular study I remember reading about the layering of green space, and there's actually 3 ways to do it. You can provide extensive outdoor environments, or you can provide very high def images or paintings or such throughout the building of landscape artwork, or you can use green materials or earth tone materials. And so that layering effect actually kind of helps us take a look at how we can bring the outdoors in both, you know, new construction and existing buildings. I think that there's opportunities for, you know, across the board of the different environments that we are creating. And this idea of, you know, kind of working with new and existing, you know, it's really highlighted some of the value that we see in these wellness amenities, especially for the end users, also for the occupants. And I'm wondering, you know, when we start talking about this extra value, you know, how can we also, you know, Robert, how can we also create value for the developer as well, not just the end user?
Well, you know, that's a great question. You know, there are so many facets of design that become factors in what I'll call a whole dollar equation. In my case, for creating commercial environments, if you're looking at resources to address trends toward health and wellness, for instance, which I think is what we're talking about much in general, what complementary trends can reinforce that? You know, what's the kind of practical give and take? You know, what's the yin and yang? You know, recent experience tells us that parking is just one candidate for how a resource shift from one amenity could translate into others. You know, it's how we can redirect one trend into other, if you will. You know, to get into that a bit, it helps to set up a couple of assertions. One is a trend for reduced parking demand over time. Of course, that can be, you know, disputed on a market or case basis, but in the main, it's something that was already deep into an adoption curve prior to COVID. The recent acceleration of that trend, if you want to call that, has been kind of a glimpse into its deeper future. It's a chance to speculate further on parking within the commercial dollar equation and how that part of a dollar might be kept in the equation but redirected. So, second assertion, for commercial office, for a long time, we've understood that the office, in terms of design, has been a shift away from its more traditional default as a place for governing output and more toward a more diverse, amenitized environment for attracting and retaining talent. Okay, so those two things together, what do we get? So, you know, looking at our recent experience, we've had a crash course on how much we can do from wherever we are. So where commercial spaces development is concerned, what good is getting together? I think we know there are lots of good behavioral and organizational reasons for that when situations require. And so the question is, can less of one traditional element of commercial development, parking, be flexed into more of the kinds of things that support in-person collaboration, for instance? So overall, the combination of these two trends might transfer resource to provide more flexible, more hospitality-oriented sort of touchdown spaces with less emphasis on purely heads-down work. It just shifts that equation in terms of office space use. You know, what are the practical design outcomes? You know, it's a matter for imagination and study, but possibilities for providing that could be a move toward more open, less enclosed spaces, more outdoor spaces, places where it's easier to establish a kind of temporary domain for, you know, ad hoc meetups, more like hotel lobbies, less like cube farms, hard divided from the outer world. Overall, these would be moves toward that were just more or less tailor-made for strategies toward health and wellness. All in all, many aspects of commercial design will benefit from being thought of as part of a large-scale transition in what the office is good for and how it's going to be returned to the market as a preferred place to be, Samantha.
Well, you know, I also wonder if we're thinking about the amenities that we can kind of transition that dollar, as you're talking about, and transition that into from parking to amenities. Are there community amenities that we're thinking of? Are we thinking about giving back to the community? And could that be in, you know, adding small grocery stores to our commercial buildings, or could that be in adding more communal spaces for the outside communities and not just the the workplace end user. But I also wonder too, we've been seeing, as far as parking, we've been seeing some parking lots and parking garages being transitioned into, the temporary drive-through testing facilities. And, I think, in the future, on-site medical opportunities, on-site doctors or on-site pharmacies might become a thing. But, Chris, I'm curious, do you think that the drive-through facilities like these that are temporary now might become a permanent fixture in our infrastructure?
Yeah, we hope not, because that was a good temporary solution that you're able to drive through and get care provided when people didn't know, about, they wanted to keep the waiting room separate. They wanted to keep people from contracting COVID from other patients. So it was a good temporary solution. I would challenge everybody on this call to, if you see those temporary solutions that we did, and they had their time in place, but they're the antithesis to the patient journey. I think we need to, or even the work journey, working from home totally, like Emily, you mentioned earlier, was a good temporary solution, but there's got to be some sort of hybrid model in the future where you're in the office at some point, virtual at other points. So this is one of those things, patient care wise, was great for, a month ago, but all of us, what we've been talking about is choice and amenities and an elevated experience. And I think that was the opposite of it. Yeah. So I think, in healthcare, we've been trending for years to a more hospitality based, a more personal, less clinical feel. So I think we look for those solutions that still maintain that we can go in the future with.
I think that less clinical feel is really important. And I see there's a question from Erica Garrison that says, as you see more open, flexible spaces, it would be hard to track who has come and gone from that space. How do you plan to address disease transmission? And, Chris, I'm sure that you have a lot of things that you can respond to in this. And I'd love to hear your response. And then I'd also like to, talk about some emerging opportunities that could be possible to answer this question.
Yeah, I'd like Emily to follow on with this, because there's a transitioning to workplace plan that she's been working on that is also synonymous to how we could use that in healthcare. So in healthcare, we'll be challenged in the waiting room space, because we know this is a disease you catch through the air. So what we've done in the healthcare space, and I think what was interesting when this first started, and we had a lot of conversations across our sectors as we became more one and more integrated, that what we are doing in healthcare has long been focused on that disease transmission between people while you're in the clinic. So the cleaning protocols, the idea of dirty and flow and clean, and the flow of your materials and people. So we had a lot of good discussions early on, just catching everybody else up with what we've been doing for our careers, for those of us who are dedicated to healthcare. So I think there's some ways that we're gonna have to look at that. Social distancing it's based in science. I know, Sam, you've done a lot of research and did a presentation last week on it, on how the cough and sneezes and just breathing, how we got to those guidelines. But I think Emily's got really good plans on how do you neighborhood places, and you restrict visitor access, you restrict access within your people who are working in your office.
Yeah, I think it's important to think about the timing of that question, because I think if you were to say, how would we deal with that right now? My answer would be what Chris said, right? Neighborhoods, making sure that we're, reducing occupancy in the office, a lot of the things that you're hearing from a lot of people out there. But then I think if we're really thinking towards the future, one thing that I have noticed is as restrictions have lessened, people have wanted to come back together. It's, a little scary for some, and it's really important to others, and everybody has a different thought and opinion on it. But I think in general, human beings, we are pack animals, and we want to be together. And I think that that's the value that physical spaces do provide, is to facilitate that. So absolutely, in the current situation that we're in, with no vaccine and no real good way to treat this, we have to operate differently. But I think it's within our nature to get to some of these ideas that we're talking about around community and things like that. And Sam, I'm wondering if I can just answer really quickly the other question in the chat about the well building standard. I do absolutely, Karina, think that is going to be something that that will be important moving forward. We have already at Corgan seen an increase in our clients being more interested in the well building standard, and some clients who previously were not interested in necessarily following through with the certification, but have now come back and said, okay, maybe we want to take another look at that. So I think for those who might be unfamiliar on the call, the WELL building standard really focuses on the health and wellness of the people in the building. So while LEED is more environmentally based, the WELL building standard is more about the person. And so it's a combination of design and policy. And so I absolutely think that in the future, employees are going to potentially demand a little bit more transparency and accountability from their employers on the spaces that they're providing for them to operate in, whether it's, you know, a workplace or a hospital or a school.
Yeah, for sure, Emily. I completely agree with you there. And that information transparency is absolutely important. You know, going back to Erica's question, how do we plan to address disease transmission? With information transparency, you know, we've been looking to future models and digital twins and how, you know, that exact replica of the physical environment can be virtual and can help accommodate, you know, even augment the neighborhood model that Emily and Chris were talking about, where, you know, we can give that information transparency to the end users. We can give them, you know, information on air quality and, you know, cleaning protocols for each room in the building, you know, right there at their fingertips. If someone has become infected and we have the neighborhood model, we can digitally shut down that area and immediately alert everyone in the building that if they need to leave the building, here are the new exit routes if needed. So there are a lot of different ways, you know, that we see kind of tackling this situation today in a pre-vaccine solution with our existing infrastructure, but there are definitely some more futuristic explanations for it. And the digital twin is not necessarily futuristic. We have digital twins that operate today. It's just part of a new construction method. So it would be more of a new construction technique. But I think that, you know, something like the digital twin is really an emerging opportunity. Like we said before, this is a technology that we've been looking at for years. And we're just seeing, you know, COVID as a catalyst for a technology like this. And I think what's really interesting is we see a lot of these emerging technologies happening because as multiple industries are coming together right now, we're all talking about one single conversation, and that's to focus on the safety and well-being of the user. And so I think it's really interesting important to keep in mind that, you know, while we're talking about some of our school models may never, you know, be the exact same as they were before, or maybe our working environments may not be the exact same, you know, we're not going back to the exact same office that we had before, or some people may not be going back to the office. But I think that, you know, we could take comfort in the fact that this virus didn't force us into this solution. This was a lifestyle that we were already preparing for. We were already headed in this direction. And we on this, you know, on this call, a lot of our experts have been doing this research into a lot of these technologies and human behaviors before COVID hit. So, you know, all of these solutions that we're bringing to the table are really solid, we believe solid solutions that are here for our benefit and to create value in the places that we design. You know, telecommuting and teleconferencing have been around for about 30 years. And there are some people I've talked to that have never done it before this all happened, before we were forced to. And so it's just, that's another example of, you know, technologies that have been around and we're just now using them, COVID as a catalyst. And I think, you know, another great example of how we're looking at other industries during this time before COVID and using what we've learned to be a catalyst past this time is, you know, we've been looking at viticulture and perfumery industries to see where we can derive value from olfactory design, you know, for intuitive wayfinding, to create more mental and spatial awareness within patients with dementia, or even, you know, to enhance our perception of space. You know, smell can change the perception of the height of a room or the width of a room. So while we're all very, you know, acutely aware of how closely we're standing to people, and we also know that we have buildings we're going back to that you can't just change the height of the building, you know, wholesale, changing that perception may help a little bit with, you know, allowing end users to be a little bit more confident in the space. And even more relevant, we've been working on Hugo with our experts in aviation and experts in NASA to develop programs that are, you know, kind of understands post-spacewalk programs for commercial space travel. And these include quarantine facilities. These also include enhanced health screening at high capacity. So we've been learning a lot of these techniques and these design, programmatic design elements way prior to COVID. And we see that these can really be turned around. Our information that we've been gathering can be turned around and help all of our different market sectors and all of our designers, our developers, our builders, and we can use that knowledge and share that knowledge. I do think that there's a really interesting opportunity for a lot of other different industries to kind of come to the table and, you know, change the way that we value design and the way that we work. And, you know, Chris, I'm really interested to understand this strange crowdsourced culture, and strange in a good way, of DIYers, of hackers and crafters and all the makers that have kind of come together during this time across the nation to really help the frontline workers by creating PPE. And I'm wondering, is this something that could, again, kind of like the drive up facility question, is this something we could see as a part of our architectural design?
Yeah, this is something that we hope that will continue in the future. I know, you know, the maker culture and doing things on DIY on your own in the healthcare space has had a long history from people, and it's been born out of people trying to fill the gaps in needs. So, you know, typically the approval process for something new has been very slow. The FDA has, you know, approval process that could take years. So people, since healthcare is such a personal thing, people have jumped in over the last, I would say 15 years, ever since we've got 3D printers and they become mass, you know, they're available to the masses. From, you know, artificial pancreases to people being able to print artificial limbs and prosthetics for countries who are expensive, or it's prohibitive or not, you know, available, they're able to donate. And so that, you know, when you're talking about as a disruption and bringing other people in, I think this has given the ability to a lot of people to jump in, mainly based out of being able to help and to provide any kind of resources that we can. I know that drug us in as Corgan, as a firm, in to help some of our partners. We were able to 3D print face shields for some of our big partners, and not only print 3D face shields, but we actually looked at the ergonomics of it. How, you know, somebody wore these 12 hours a day, how do we improve upon the process? So that was a neat thing for us to be a part of. And there's large independent practice in north of Dallas, that Village Health Partners, that we printed, you know, numerous, and still are printing numerous face shields for them because they run a COVID clinic on a couple of days a week. And we're also able to partner with USC in California. So we've seen the outpouring of everybody being able to do this. And I think this is a catalyst to bring more companies in that have this ability. And I think that maker culture has been in the school system for a while. That's part of the training and with STEM classes and people getting more involved, and it's starting in the primary school as well, right, Jason?
Yeah, absolutely, Chris. Yeah, there are a couple of things that you said that really resonated with me. You know, yes, there's that maker culture, and I think, you know, as students become more aware of life on a global scale, I think as a result of everybody in the world going through this together, they're going to be developing a lot more empathy and just emotional thought there, and that's something employers value very much, along with adaptability and creativity. But for maker spaces, you know, they can be connected to laboratories that are remote in different parts of the world. So you said, you know, 3D printing for people in countries that don't have access to modern technology. How can we allow students to what they're building physically and digitally where they are in their school to really have an impact globally as well? And that is a change we're seeing, you know, not just from project-based learning where they're given a task and trying to create a project, you know, based on what they're learning, but problem-based learning. And you bring up a lot of problems that are in the world that different technologies and people are working to solve. So I think when students can start to become part of the solution to things, they're really going to be more engaged and you know, learn about flexibility and you know, collaboration, so many things that are a priority. A big problem, of course, right now, like we mentioned, is what is going to happen when school comes back this year. I think there's an opportunity for kids to get involved in that conversation. You know, if we as designers or teachers and administration are able to reach out to them and get them involved and get their ideas, I think there could be some engagement from them and some ownership of what's going to happen. It could potentially, you know, see this as a little bit of an adventure coming back to school, as difficult as it would be for so many kids to look at it that way.
Well, it seems like a much more humanized process as well. And I think, you know, we're probably seeing that, you know, Emily, Carolyn, we're probably seeing that in the workplace as well.
Yeah, I mean, this whole idea of humanizing, of empathy, just like Jason said, is really, really huge right now. And Sam, you mentioned the olfactory design and the importance that the senses play in placemaking. I think is so important, and maybe something that we should really be paying more attention to, designing for all the senses. So, when you go somewhere, you have an experience that you experience in multiple different ways. So if you go to, like a football game, you're smelling the food from the tailgate, you're hearing the noise, you're getting, enveloped in the crowd, and we're passionate, we're excited, and we're rooting for our team, and we're all together. That's a whole experience, right? And it's created by all those different senses. And it's a different experience than when you see it on TV. And then if you were to say, go to, I don't know, like a spa or something like that, and you've got different scents there, people are more quiet, the lighting is more toned down, the furniture is more comfortable, it's a little bit more of an introspective experience. And so what I'm really excited about, and I think hadn't really thought of as much until this whole situation that we're in, is the idea of designing the workplace with all of these different senses in mind. And so how can we create places that people really want to go to for an experience, I think is fascinating and such a neat opportunity that we have moving forward.
Yeah, and Carolyn, I think you probably have some experience in this area as well.
Yeah, I mean, just so Emily is mentioning that experience in the office, but also think of it conversely, right? Back home, technology has entered the home and kind of disrupted what we have previously divided as our personal private life, right? And so, we've been thinking a lot about, is there a new typology or emerging typology that will come out of all of this? There's been articles written by, architects, and one in particular, Raphael Moneo, did an article in the 70s that talked about typology and how things don't change, or typology is like a school or a library. They don't shift unless there's instability or giant cultural shifts in our society, right? And those shifts become mirrored and built in architecture and interior design. So everything we build and construct is kind of a monument of our time and the things that we believe in. So looking at the home and the office, how it's kind of been merged, has been really interesting to us. And one example that I can think of is, during quarantine, I was trying to support a local business, and because they couldn't have their storefront open, I had to, I went to the shop owner's personal home and personal apartment to go pick up the goods I was buying. And just so, and messaging with her, she was trying to understand how to get this whole thing to work from her house. Spurred a lot of questions and discussion on our end. And there's a example in Austin nearby that's been built for 10 years, so it's not new, but it's called Cobra Studios in Austin, where it's basically a unit that's got your plumbing and your kitchen in the middle, and then 2 open spaces with garage doors on both ends that allow for ultimate flexibility. So imagine being able to, during time of quarantine in the future or whatnot, you're able to sell your goods from one side of your house or work from that side of the house, but then also shut it down when you want to just be home in private. So we're really curious as to what's going to come from this, and how this typology can emerge, how that can be replicated on a larger scale for dense housing and for multifamily. It's just really exciting to kind of to see how something like this can re-energize environments, make them more resilient, for who knows what will come in the future, right? So that's something that we're really interested in right now.
Yeah, and that resiliency is really important. And it seems like the user experience is just about to kind of evolve in all different aspects, excuse me, of the architectural and built environment. And I'm wondering, Robert, are there any areas where you've seen new opportunities for us as architects and developers and builders and designers to rethink the value that we put on place?
Yeah, I think, Samantha, the opportunities are vast. I think there are a lot of thoughts here that have been well and meaningfully said by everyone here today in the space of 1 hour. But to me, I think it's obvious that right now and going forward, we have a chance to revisit commercial and communal space in general, and to challenge some of the defaults that have applied over time to our habits of work and occupation. It tells us that old norms are going to sunset just that much faster. And we're living through a rigged kind of lab test, if you will, for this kind of groundswell that has already been in play for many trends that we've mentioned today. And another thing that we're relearning is that most of us need our work presence to go beyond our screen presence. It points back to what's good about being together physically. It's organization dependent, of course, but depending on your industry or type of work, it is more or less a central matter of what I'll call human tribal politics. Part of what we're faced with is how to return to communal space as a preferred choice, not a return to previous defaults, but more a renewal of a vision for it, a rediscovery of it, a reinvention of it as an optimal, active participant in our collective civic world. You talk about possibilities, as designers, it's always going to be tempting for us to leap forward to apply, form and presence to things in terms of physical design. If I'm pressed for an answer, it's a general one, but it's tempting to see outcomes that blur margins, between inside and outside, between public and private, between institution and community, between work and not work. It's a chance to blur margins in ways that challenge our previous defaults. It's a way to look at experience of our work life more in terms of, I'll call it a whole life, and as less divisible from it. It's my choice, and I think it should be the choice in general to approach any situation as an optimist and to see the possibilities. There's an overabundance of short-term predictions that, about air filtration and hand sanitizer. And, I hope it's come through that that's not really what we were hoping to cover today. We were looking a little beyond that. So really briefly, I'll wrap it with an assertion that, the road ahead is less about what we have to do now and more about what we get to do now. That's where we see opportunity, Samantha.
That is just an incredible way to kind of wrap up this webinar. And I just want to thank real quick all of the panelists that have been involved today. This conversation is very, very vast, like Robert said. There are so many things to take away from it. And I really hope that you understand that we are really intently discovering and developing solutions, not just for today, but keeping eyes out for opportunities tomorrow. And so thank you to our amazing panelists. Also, I just want to remind everybody that this is just the first of 4 webinars. Each of them are focusing on a different chapter in this publication, and the publication launches today. You can find it on our website at corgan.com. It's in our blog. And we also have some conversations on the Square episode, which is our podcast, with industry experts that have worked with us to develop this publication. So again, thank you so much for sharing your time with us, staying tuned with us, and participating in our discussion. We really appreciate it. And we hope that this was helpful for you. So thank you very much, everyone.